now. So I've just begun that recording now for you. The second thing to do is I just ask that everybody just keeps their microphones muted when we have presenters talking. We really want to hear this important information from these presenters. And I just ask that you keep those muted. But if you've got any questions about that, you can direct them to me in the session. And I have a couple of little housekeeping things here. So we will be using the chat window. So the chat window there is going to be a great way for us to be sending you links and information on today's session. So I ask that everybody tries and locate that chat button icon that I have on the screen here. Open that up. We are going to be sending through lots of useful information through that chat window. But we ask that you please use the questions and answers section to be able to ask your questions for the panelists into using that function, not that chat window. So we'll be using that chat window to provide you information, and we ask that you use that question and answer section to pose your questions to panelists as we go. If you're having trouble locating either of these options, the question and answer or the chat, just check the ... more option, because often it can appear there. Again, you can message me directly as the Workery host. Directly through the chat window, you can send me a direct message. So without further ado, I'm just going to return to our presentation, and I would like to introduce our MC for the day, Heather. Heather, if you're coming up on screen there, fantastic. Take it away, Heather.
Thanks very much, Chris, and welcome everybody to session 2 of the GambleAware Fairfield Forum. And thank you very much for joining us for this really important event today. I'm Heather Nesbitt, as Chris said, and I'll be your host for this session. So even though, you know, we're in the times of COVID and face-to-face get-togethers and events has sort of halted, we still felt it was really important for us to get together to talk about this very important topic. And that's why we've had this, we've organised this virtual event, Council's organised this virtual event, which has been fantastic. And we're getting really good response to that. So it's such an important issue for our communities, and one that we really felt was important to learn more about what's happening in the field, and certainly raise awareness about the impact of gambling and harm minimisation opportunities that we can look at. So we're very privileged to have a number of very high quality speakers with us this afternoon. We've got researchers, peak organisations, people with lived experience, which is terrific. And many represent diverse communities across Fairfield, which of course is a beautiful city of such cultural diversity. We're really pleased to have everyone with us today. We're here to share and learn about the topic, and I encourage you to respond to this session in this way, that we're here to listen and learn and share that information. So we had a session 1 this morning that was really looking at gambling harm and understanding the impact and finding support. This is session 2, and session 2 of this public webinar is really about, it's a showcase of local gambling initiatives and projects, 3 of which are happening now in the area, and 3 new funded projects that will be really exciting to hear more about those and what they're going to be doing. So I'm really looking forward to hearing about all of those projects actually. At session 3 later on this afternoon is a closed meeting where a number of stakeholders will be getting together to talk about the information we've heard today and to work out how we can work together to reduce gambling harm. So it's a really full event, and I'm really pleased so many of you are rejoining after this morning's session, or if you just come now, there's still a lot to hear. Because it's a very full program, we're going to do some of the questions at the end of some of the sessions, and I'll let you know when that might be. But get your questions happening in that Q&A box, as Chris said. So that's really, really important. Please tell me who you want the question aimed at, which presenter, and also to keep your questions short and obviously respectful. That's very important. And finally, as Chris said, these sessions are going to be recorded, and the session 1 and 2 will be publicly available, and we'll send you links to those. Some will be on WebTube, and you'll be able to on YouTube, and you'll be able to download those and watch them, and to share them amongst your networks, which would be really good to do that. So just in doing that now, I suppose for all of us, there's probably no better example of that importance of sharing knowledge and learning than that set by our First Nations people. And we're very delighted to have Uncle Darren Duncan with us today, who's the Cultural and Heritage Officer at the Ganangara Aboriginal Land Council, and he's going to present a welcome to country. Welcome, Darren.
Thank you, Heather. Is my video start? My video. There we go. Good afternoon and welcome all participants to this afternoon's online gambling awareness forum, hosted by Fairfield City Council. On behalf of Ganangara Aboriginal Land Council, we acknowledge the families within the Cabigal clan of the Darug Nation as the traditional custodians of the land we span, which include the Fairfield area. On this day, as we come together to raise awareness about the issues of gambling harm in our community, we pay our respects to elders past and present and emerging, and to all First Nations people within our community today. On behalf of Melissa Williams and Ganangara, we thank you and welcome you. Thank you. You're on mute, Heather.
Sorry, thanks, Darren. Oh, look, how are we going to go for the rest of the day? This is going to be interesting. So thanks, Darren, very much. Now, our first presenter today is Nick McGee, and Nick is going to talk to us about a screening tool, a new screening tool that has been being developed and implemented in the area. And actually it was the topic raised in session 1 this morning. So Nick's going to talk to us about that tool and how people can access it and the like. Nick is from the Southwest Sydney Primary Health Network, and he's presenting on this screening tool. He's currently the Integrated Health Coordinator for the Primary Health Network, and previously managed this project, this screening tool project, through the Fairfield City Health Alliance. If you read Nick's bio, it's pretty extensive, as you can see, and certainly he's a bit of a media star, I can see there. Certainly he's a very experienced communicator for the healthcare industry, and he's led some partnerships, a number of partnerships for key organisations. He has a very keen interest in supporting programs, projects and initiatives targeting gambling, associated harms, and having a lived experience. Welcome, Nick.
Thank you so much. And media star, let's lead with that, hey? Sorry, let's get my screen sorted out. So I've been having issues with my internet as well, which kicked me off completely before. I'm just going to start my video too, so you can see me. Everyone can see me okay? And hear me okay?
Perfect, Nick.
Great. Thank you. Thank you so much for having me along today to talk about a really exciting pilot project that we just finished up. It was funded by the Office of Responsible Gambling. But basically, as Heather's mentioned, thank you very much again for the warm introduction. It was looking at how can we screen for gambling harm in GP settings and also in community service settings, something that we obviously recognise isn't widely done. Just a quick agenda that I'm going to go through with you briefly this afternoon, just to tell you a bit more about what the Fairfield City Health Alliance actually is. A little bit about gambling in Fairfield. I know we've kind of covered a lot of the stats this morning. Some of the issues, the current issues around screening and accessing assistance in New South Wales. And then we'll move through to what we actually did, and I'll show you an example of the tool that we actually developed and rolled out and implemented. And then we'll have a look at some of the results, and also just let you know I guess what our recommendations, our final recommendations were to the Office of Responsible Gambling, because we did do a quite large, extensive final report back to the office, and what we perceive the next steps to be, and hopefully how everyone can help. So starting off with, well, what is the Fairfield City Health Alliance? It's actually a really unique collaboration. So we've got Fairfield City Council, the local health district for Southwest Sydney, and the Primary Health Network all working together. And there's basically a joint local health needs assessment that basically, of course, uncovered that gambling is a major issue in the council area, in the broader region of Southwest Sydney, and indeed New South Wales. We did establish a wider working group as well, which did include service providers. It had academics. We had key representatives who actually led the training, development and implementation to the people who got involved in our screening tool project. As I mentioned, gambling in Fairfield, I think we recognise all these issues. I mean, we talk about financial issues, of course, all the time. Only tells, of course, part of the story, but these statistics always shock everybody, and yet we don't screen, and we don't seem to be making a dent in these numbers. In fact, they're getting worse. Some of the issues that obviously, I guess, preceded the project and obviously still there, is that we know that only 8 to 10% of people with gambling issues seek formal help. We know there's various comorbidities with gambling. So what that means for everybody is that we've probably got people accessing mental health services or community health services who may not necessarily be presenting for gambling, but gambling may be a factor or maybe behavior that's causing harm in their life. And we know, of course, that GPs and community workers are not routinely screening for gambling harm. And particularly in the case of GPs, I know community workers are a bit more clued up on obviously the various support services out there to assist those experiencing gambling harm, but particularly GPs are largely unaware of the free referral options to those free gambling support counselling services in New South Wales. So what did we actually do? We engaged about 150 people in what we call a co-design process. So it was quite an extensive bunch of activities that were completed by the project team prior to me coming on board. And I like to say they did all the hard work before I came on board, because I came on board for the implementation phase. But the project team prior to me, they engaged, as I said, over 150 people in actually getting everyone together in a room, designing, talking about the tool, and actually voting on a tool, which I'll show you in a moment. We then, with all that information, had a tool, and then we held a webinar, because of course we need to train up participants. And participants for the purposes of our research project were GPs and community workers. And we did limit it to the Fairfield local government area. We did develop, of course, an information resource kit as well. So it did go through all the available services. We had, of course, all the webinar training material, easily accessible for them. And we even did some translations. So everything, posters, patient information flyers, and even the screening tool itself. They were translated from English into Vietnamese, into Assyrian, into Arabic. So we had, I guess, those really key local languages covered by this screening tool and the associated material. We then actually implemented the screening. The implementation phase was challenging, and I think it was for a lot of people trying to run projects during COVID, but we decided to press on, and we did move a lot of the materials to an online format, just to recognize that GPs and community organizations, of course, were running things either over the phone or they were doing them via video consultations. And that seemed to work really, really well. We did one-on-one interviews with each of our participants and got some overwhelmingly positive feedback about how well received it was and how comfortable in the end and really quite quickly they were able to pick up how natural it can be just to ask some simple questions around gambling behaviours. And I think one of the key aspects of our project was normalising the actual questioning. So everybody was asked. It wasn't, there was no prerequisite to be asked. And that really assisted, particularly I think the GPs, in saying, well, the computer's just telling me to ask you these questions, rather than it being seen as you're targeting me because of X, Y, Z, could be, demographic or whatever. And as I previously mentioned, we then obviously completed a major review, and we've put together our recommendations. Now, at this point, I'm just going to break out of my presentation. So I'm just going to stop sharing my screen for a second and just do a new share, just so everyone can get an idea of what the actual screening tool itself looked like. If I can find it. Well, if I just share that. Sorry, everyone, bear with me. Sorry, everybody. Everyone see that okay? I hope so. So this is the gambling harm screen itself. We had a bit of a preamble that the GP or the community worker could actually go through with the patient or the client. And this is where the questions start. So we basically combined the problem gambling severity index short form to basically go through some questions around an individual's gambling behavior. So that's when you can see, have you ever gambled from downwards? And sorry, just a comment, I'm quite happy to share this with anybody who's interested as well. The second portion of the screen was actually asking about affected others. So this question here, do you think you've ever been affected by someone else's gambling? So we combined that, and that's the concerned others gambling screen, the COGS. So unique as it was, I suppose, we kind of combined the two into a really easy to use, short screening tool that's hopefully capturing not just the individual who's participating in gambling, but also, of course, those affected by that person. And of course, we know that's at least 5 to 10, if not more. So I'm just going. So the suspense should be building now. The results. And really shocking results, really. I think we were all really surprised by just how much harm we picked up. So in the end, we did 141 screenings of patients or clients. We had 10 community workers involved in Fairfield LGA and 2 GPs. And that was over 13 weeks. You can see there 60% of those that we screened are experiencing harm from their own or someone else's gambling, which is an enormous number, horrendous. Couple that, of course, with 23% of people who identified that they'd been affected by someone else's gambling in the past. Now, the referral rate was a very interesting one, and it's something that obviously I think we need to work a lot more on, is when gambling harm is identified, what happens next? So we had 37% of those who came back with a positive result for some level of gambling harm. with information provided to them, which is very low in our opinion, and same with the referral rate as well. So certainly room for improvement in the outcomes for the patient or the clients. We looked at obviously all the interview data, and we looked at all the result data, and that's obviously just a snapshot what I showed you earlier. There are some nuances, of course, in other areas of our data analysis, but we did put together these key recommendations. We believe, obviously, that the screening model developed was effective and scalable. We heard that from our participants, the GPs, the community workers. We saw that in the results. And we know that community services are uniquely placed as well to implement the screening model, because they do have established intake processes. So we kind of thought, well, it's quite a natural extension for a community service to actually start asking about gambling harm as part of the initial intake, and indeed ongoing. We did recognise with GPs that to improve uptake and ongoing usage, that integrating it into existing screening that they're doing. So I'm sure we've all had experiences where we've been to the GP and they ask us about our lifestyle. They ask, about, do you smoke? Do you drink? If yes, how much? So those sorts of preventative health interventions that are, I guess, well established now in general practice, we feel is obviously really, really essential that gambling becomes a part of that screening. Now, an indicative screening outcome based on patient responses would help guide interventions. What we mean by that is we found that GPs and community workers weren't necessarily recognizing that harm was there, even though it was from the responses. So on our gambling screen, if they answered anything other than never, then there's some level of harm. And I think a lot of what we found from our data analysis was they weren't necessarily recognizing that. So what we suggest is, if a tool is to be rolled out and utilized, which we certainly think it should be, there should be an indicative outcome. So, a bit of a red flag, harm has been identified, just to flag that with the person who's completing the screening. We hope that would improve the outcome for the patient. So whether that be information being provided, or of course a referral taking place. This one, potentially a little bit controversial, but we just find, and particularly where I work in the primary health network, we have access to a suite of population health statistics. A lot of that's from GP's software, which is then amalgamated, and it's all based on incentives that then the Department of Health will feed back. We don't have that with gambling. For GPs, I know, of course, gambling counsellors report back to a centralised data store, but to get a really useful data set, we feel that a centralised data store of the screening results would really better inform state policy and local health needs assessments, particularly when 60% of people that we screened came back with some level of impact of gambling harm. If that was true in a much larger sample size, we'd be certainly pushing very, very hard for state policy change, and of course, more focus on local health needs assessments for gambling harm.
Thanks, Nick. That's really good. I have to, hopefully you
Sorry,
finished. That's all right. That's all right. Great. That's terrific. We did start a little late. So thank you very much. That's really terrific. Some great data there, and really, really interesting of how it's been applied. I hope you can hang around, Nick, so to take some questions later on. And if people have some questions, please put them in the Q&A. Our next presenter is Tom Nance from the Western Sydney Community Forum. Many of you probably know Tom. He's the Manager of Policy and Programs at Western Sydney Community Forum, and he leads many major projects and teams that benefit the community and services industry across Greater Western Sydney. He's a qualified social worker, and the project he's talking about today is the culturally culturally responsive practice, gambling-related harm framework. Thanks, Tom.
Thank you, Heather. And I will quickly share my screen now. So I just wanted to, of course, start off by acknowledging the traditional custodians of the land that we're all gathered on today. I myself find myself on Darug land today, just off the Parramatta River. I want to pay my respects to elders past and present, as well as the emerging leaders within the Aboriginal and Torres Strait Islander community. And I'd like to extend my respect to our Aboriginal and Torres Strait Islander colleagues here with us today, and also thank Darren for welcoming us today. So I am going to be talking about the gambling-related harm framework. And before I do, I want to acknowledge that just like Nick, I am one of a team of people who've been working on this at Western Sydney Community Forum. So I want to acknowledge my colleagues, Stephanie Adam, Billy Sankovic and Anna Keena Water as well. And also acknowledge that this work has been commissioned by the New South Wales Responsible Gambling Fund that's administered by the Office of Responsible Gambling, and thank them for their support. So we have been working very hard on this for the past 12 months and are due to be releasing this framework to the general public at the end of November. But I wanted to take the opportunity to talk a little bit about some of the components that will likely be part of that framework, and also to give you a quick scan of what's been happening there. So firstly, I guess what's important is to briefly outline the purpose. And the purpose of the project, of the framework itself, is to enhance capacity of our service system to provide appropriate and effective responses when it comes to people experiencing gambling-related harm. And that factors in not only the individual level in terms of response, but also the systemic response that we're all part of. So I'm just going to skip forward now. So in terms of the framework, just quickly, it's really about a couple of key things: about strengthening practice knowledge and skills, increasing service accessibility and uptake within the sector, providing effective and appropriate support and intervention options, recommending tools for implementation, and finally, contributing to the evidence base of practice, which is really at the heart of the framework. So we've taken a phased approach to this as we come to the conclusion of our framework and releasing that. But first off, we went through the establishment phase, which was really about recruiting partners, forming an implementation group, and developing our research methodology. We then moved through our discovery phase, where we looked at the literature in some depth, as well as collected case studies, both on individual and a worker level. We conducted focus groups that looked at the issue of gambling-related harm and the responses to it, as well as doing an in-depth practice scan of what was working, both within Western Sydney and also within the wider world. We then moved into our development stage. So once we completed our discovery phase, once we'd done all of our homework, we looked at developing the draft framework. Alongside that, we were looking at what tools could be part of that, as well as how we could use digital capabilities to roll out this project. We are now concluding our testing phase, where we've been working with our peers and our pilot partners in terms of finalising the framework in its next iteration. And from there, what we'll be doing in late November is disseminating. So there will be an ESYMPOSIUM, and we will be working with organisations to support them to embed some of the practice that's talked about as part of this framework. So I should acknowledge there has been a lot of data that has gone into this framework, and a very very thorough approach taken by my colleagues at the forum. We recruited an implementation group with 19 agencies representing the public sector, the community sector, and also academia. There was a thorough literature review, as I mentioned earlier, looking at both national and international data. And we looked both at research around culturally responsive practice and how that could be done better within community services, as well as literature around gambling-related harm and how that played out both within mainstream communities and also culturally specific communities. We looked at and sourced case studies of lived experience with 12 case studies looking at the experiences of people who were either directly impacted or impacted through others in terms of gambling related harm. We recruited and conducted focus groups with practitioners, with 3 focus groups and 24 practitioners informing our data and our, I guess, framework report that you'll hear about in a minute. We also conducted the practice scan, looking at gambling harm minimization strategies, and we looked at 14 agencies and talked to 15 practitioners, really about what was working for them in terms of combating the gambling related harm and the impact of that within their communities and on an individual level as well. And finally, as I mentioned, we are working currently with 4 agencies around pilot testing. So looking at how they can apply this framework, how they can apply the framework and how it needs to be refined further to make it as accessible and as informative as it can be. So the gambling related harm framework really consists of 3 key elements. The framework reports, which is really that academic piece around what the literature and what the data tells us, as well as that primary research that we did, which is incorporated in that. And it looks at a lot of the themes underpinning gambling related harm within culturally diverse communities, and also looks at the ways organisations have been working with that issue. We have our second element, which is the framework in action. And that is really about equipping practitioners and organisations with some key tools that they can use in terms of upskilling and in terms of thinking critically about their practice and how they can I guess, work more effectively with people and communities being impacted by gambling related harm. We also have the Framework Clearinghouse, which is our home for information related to gambling related harm, which we'll talk about a bit later today. In terms of the reports, you'll be able to read the full reports when we publish this framework in November. However, I wanted to give you a bit of a sneak peek of the framework, if you will, that we've been working with. So we, in our, I guess, extensive look at the literature, have really looked at the 3 frames that underpin practice in this space. And it's really, firstly, about cultural knowledge, and we need that knowledge to design services in a culturally responsive way. We also talk about cultural practice, and this is how we deliver services. This is how we work one-on-one with clients and with the broader community, the way that we do things. Finally, we have also included in our thinking cultural change to embed service. If we focus solely on cultural knowledge and cultural practice, we're not breaking those cycles. We're not looking at how we can achieve long-term change in terms of behaviours and in terms of also how we work as a sector around this issue. So those are the 3 frames that underpin our framework. We then move to our 3 elements. The harms, which were identified by Langham et al. In their taxonomy of harms when we think about gambling related harm. The stresses, which we identified through our extensive review of literature and our conversations with practitioners. And the strategies, which we have, I guess, I wouldn't say unearthed, they've been there all along, but we've amplified from our conversations with practitioners in the space. So when we talk about the harms, it's important that we, again, view these over the top of our 3 frames: cultural knowledge, cultural practice, and cultural change, because it's important to view them in those 3 contexts. So when Langham et al. Talked about the harms, they talked about the financial harms that come with gambling related harm. They talk about the harm to relationships and the impact that that has. They talk about the psychological harm that gambling can often cause, as well as the associated harms to people's physical and mental health. There were also harms identified in terms of work and study, people's ability to hold down a job or to continue with their education. There were criminal harms identified, the fact that often people turn to crime to either offset their losses or to cover them up altogether, as well as finally cultural harms, so those harms related to people's cultural identity and the stigma it might attach. So as I say, it's important to review each of these harms, not solely through cultural knowledge lenses, not solely through cultural practice lenses or cultural change lenses, but through all three. When we move to our next element, we talk about the stresses, and these were identified through our literature review. There were really 5 stresses that came up, and they were around help-seeking behaviours or a lack thereof, which could cause additional stress or additional vulnerability to gambling-related harm. There was also a clear, identification in some of the literature around people's socioeconomic status, and those coming from a lower socioeconomic status were often impacted at a higher rate. There was also the points around the experience of culturally and linguistically diverse groups as a minority, and that unique experience that they have, as well as experiences related to migration. And finally, community resources, and often the lack of community resources. So if we skip forward, and I'm aware we're behind time, so I'm going to skip forward fairly quickly. We talk about the different strategies that can be undertaken or that can be considered by community organisations. Strategies around access and inclusion. So we need to make sure our services are accessible and inclusive for people from culturally and linguistically diverse backgrounds. We also need to be aware that whether we are a counsellor working one-to-one with clients or whether we're community development workers, we need to be aware of how community engagement impacts in our work. It's also important to acknowledge the role of lived experience as a key strategy and unlocking that in our work, as well as providing tailored and bespoke services to communities. What works with one community may not work within another community. We also acknowledge the need for strategies to be evidence-based and often delivered by people with specialised skill sets. And finally, the role of community education as part of that. It's important to note that the 3 elements don't exist in isolation. We need to look at this as a whole picture. So for example, if we're looking at successful community engagement strategies, which appear on the right-hand side, we need to keep in mind what help-seeking behaviours in terms of a vulnerability or stressor there exists within a community. We also need to be aware when we talk about community engagement of the different harms our community might be experiencing to better inform our practice and our approach. These 3 elements and the approaches that sit within them can't be viewed in isolation. And this is why these 3 elements right here, underpinned by those frames I talked about earlier, make up our framework. So just quickly, and I'm going to whiz ahead, when we talk about the framework in action and some of the tools we'll be offering, we are currently putting the final touches on our e-learning hub, and there will be modules that service practitioners and service providers as well can undertake, both on an individual level and also as an organisation, that will upskill their staff in terms of gambling related harm and how it relates specifically to culturally and linguistically diverse communities. We are also providing a range of implementation tools for organisations, things like a readiness self-assessment score, case studies around lived experience, as well as practice case studies that draw out some of the key elements of why an approach was successful, as well as our practice e-template for review and design that provides questions and reflection prompts to inform your practice and hopefully shift you towards more impact. And finally, our framework ESYMPOSIUM that will be happening in November that I will touch upon in a minute. In terms of the clearinghouse, people will be able to access a range of things. Our language guide, where we have actually provided information and insights around how you should be talking about gambling related harm in a way that is more empowering for communities and communities from a culturally and linguistically diverse background. We also have our Vault of Possibilities that has a range of suggested projects that you can undertake or you can use as a springboard for your organisation. So rather than reinventing the wheel and having to do a brainstorm about what you can do, it's already there for you in that vault. We also will be running a series of interactive live streams and podcasts as well, focusing on gambling related harm and hearing from practitioners about their experiences. We also have been able to source from our partners some policy templates. So if your organisation is looking at putting an organisational policy in place around gambling related harm or the impact of gambling, you can go there and use one of our templates to make your life easier. And finally, of course, we have provided links to further research, useful websites and further reading. So just quickly, Heather, I'm aware you've unmuted, but you're going to tell me to stop. Just
Yes.
very quickly. Tomorrow, in fact, we will be having the first live stream in the space of gambling harm. And we'll be hearing from the Reverend Tim Costello, as well as Dr. Kate DaCosta and Dr. Anastasia Horonis around this. So make sure you tune in. And I know that Martha will be pasting that link into the chat. As well as that, we will be having our ESYMPOSIUM and launch. So visit our website for that link, or alternatively, Martha will be pasting a link that you can click on, enter your email into, and you will receive a calendar invitation to make sure you don't miss it. So that is it from me.
Thanks, Tom, very much. Really appreciate so much great stuff there. What a fantastic project and so many resources. I'm sure everybody really invaluable work that you've done there. So thank you. Tom can't hang around. I believe he's got to go off to something else. So, and I know we do have one question for you, Tom, but I might move on because I'm aware of time and other presenters waiting. So we will get some of those other questions. There's a question for Nick that we'll come to later on in the session also. Okay, so our next presenter is Kate Roberts and Barbara Biego from the Gambling Impact Society. And they're going to talk to us about, from a consumer's perspective, how these projects or similar projects can be applied and what does it mean for consumers in their work, in their organisation. I think it's really important to hear from consumers and that consumer perspective. So Kate, if we have you there, it'd be great to hear from you.
Yes, actually, Heather, I'm going to introduce my colleague Barbara, who has been the gambling project officer for us with our Consumer Voices program in Southwest Sydney, to share some of her experiences of rolling that program out over the last 18 months in Southwest Sydney and some of the lessons that we've taken from that. So Barbara, are you there now?
I'm hoping you can hear me. Can you hear me?
Yes, we can hear you.
But I've got a box up saying unable to start video because the host has stopped it.
Oh, okay. Well, maybe the tech help behind the scenes might help you with that. But in the meantime, perhaps you can actually just give us an outline of the work, the wonderful work that you've been doing in Southwest Sydney that's reached out to over 800 participants at this stage.
Well, thank you, Kate, and thank you everyone for inviting us to be part of this forum. And just before we start, I want to acknowledge the contribution of Fairfield City Council in all of the initiatives that they have put into action around challenging gambling harm in their LGA. It's very, very impressive. And I'm very grateful to be here. And I've got a little box saying start my video. So hopefully you can all see me. Hi, welcome. I didn't do a profile, but I'll just give you a couple of moments about me. My name's Barbara Biego. I'm a psychologist. I've been working for over 20 years in the gambling related area. I'm sort of semi-retired and I'm working for lived experience. I also have a PhD in Asian studies, so there you go. My work with Gambling Impact Society has been as the project officer for Southwest Sydney. This has involved me in organising educational sessions, and in our educational sessions, we bring together our lived experience volunteers with local gambling help counsellors, and they go out to various agencies and organisations throughout the community doing education around reducing gambling harm. Now, we have a set format to our sessions where our lived experience volunteers tell their story about their own journey and through gambling harm and recovery. And then the gambling help counsellor has the opportunity to talk about his or her local service and talk about Office of Responsible Gambling help services across the state more generally. Then it's opened up for Q&A. This is a tight ship. We do these sessions in 1 hour and they work fantastically well. I cannot recommend enough that people book one of our sessions when we've got funding. At the moment, we're hoping that Office of Responsible Gambling will give us some more funding. From my point of view, I just want to refer to the efforts of the previous 2 speakers. Now, if you think about that, those staggering statistics that Nick put up, but if you also think about the staggering statistic of 10% of people going on to get help, what are we about? What we are about is trying to get into that nexus between people developing knowledge, people being informed, people understanding gambling harm and having a language to talk about. This is ordinary people out there in the community having a language to talk about gambling harm, and then having some basic strategies for accessing help and getting help. Part of why we exist is we know that so few people are actually accessing help when we know that the problem is so great. I guess the other thing I wanted to comment about with respect to what Tom was talking about, he was talking about, you know, he had those various charts to do with aspects of culture. I think it's very easy for us to underestimate how enculturated so much of what we do in day-to-day life is. And for myself, coming into working in health education with Gambling Impact Society, and having come through, having been a psychologist, working as a counsellor, the whole notion of counselling is very culturally constructed. And for a lot of communities in Southwest Sydney, actually facilitating an opportunity for people to imagine that they could ask, that gambling problematically is a problem, number one, that even, you know, relatively low amounts of gambling can result in gambling harm, but that you can actually get help for this, that going and asking for help is okay, and that there are services that we can use, and for people to become familiar with the idea that going and getting counselling is an okay thing to do, whether you're a person who's gambling or whether you're a family member of someone who's gambling, that it is okay to do. I guess thinking about how challenging and enculturated it's something like that can be, the other thing I wanted to really emphasize based on the stuff that Tom was talking about is that part of what we really want to do through our lived experience storytelling is to facilitate hope. That, I mean, just working in Southwest Sydney over the last 18 months, I've actually encountered situations where people have actually said to me, well, you know, there's no hope for people who gamble. That is not true. There is always hope for anyone that has a problem and can seek help. And I really want to emphasize that with our lived experience speakers, our lived experience speakers are not clients. They are people who are working to facilitate an awareness of gambling harm in our communities. They tell their story as a tool for education. They are colleagues, they are peers in the journey through gambling harm and recovery. And I really want to emphasize that it's really important that when people tell their story, we allow space to hear that story, that we have the opportunity to hear that story and to ask questions. And I find that even with my colleagues, even with other psychologists, social workers, mental health workers, I'm constantly taken back on the limitations of people's knowledge and awareness of gambling harm as a problem in our community, let alone the vast dimensions of this. And that is what we are about. And I have really valued the opportunity to work with our brilliant team of volunteers, to work with the great team of gambling help counsellors in Southwest Sydney and the various hosting organisations. We have been able to reach out to TAFE students, to community groups, to professional groups. And for instance, Western Sydney Community Forum has had one of our sessions, you know. And also, having started off by praising Fairfield City Council, I want to mention ATEM, because through the Fairfield Multicultural Interagency, we have been given a great intro into the people and organisations of Southwest Sydney. We're just beginning, but there's hope for the future. Thank you very much, everyone.
Thank you, Barbara, very much. That was a very passionate presentation, and I do appreciate that. And it's so important to hear from consumers and people on the ground and people with lived experience. So thank you very much. And thanks, Kate, for bringing that to us. People might have some questions that we'll go to later, but I do want to go to our next presenter, who's waiting patiently there. And our next presenter is Dr. Elizabeth Conroy, who's a Senior Research Fellow and Higher Degree Research Director at Translation Health Research Institute of Western Sydney University. Elizabeth's research focuses on the health inequities experienced by marginalised populations, and her project today looks at the early identification of gambling comorbidity in a hospital setting. Please welcome Elizabeth.
Thanks, everyone. I'm just going to get my screen share up. Okay, so today I'm going to talk about a couple of projects that I've been involved in with Drug Health Services in Southwest Sydney around improving the capacity of clinicians to identify and respond to gambling comorbidity. So this is a program of research that was initiated by Drug Health Services in Southwest Sydney. So we have a number of clinicians and researchers from Drug Health involved in this. We're also very lucky to have Chris Moses from Mental Health Services involved, who was previously the gambling help counsellor for Southwest Sydney. And there's also a small team of us from Western Sydney University involved. So there are a number of projects that our team is involved in that overall are trying to address three main questions. One is related to the prevalence of problem gambling among patients presenting to healthcare facilities within Southwest Sydney. And we are particularly interested in looking at and understanding the patient and treatment characteristics that might be indicative of someone having problem gambling across those different settings, so that we can then develop, improve our detection of problem gambling and develop better screening and referral processes to address the harm. So there are two healthcare settings that we're focused on at the moment. The first is the hospital setting. So we know that problem gambling is highly prevalent among people presenting with psychiatric, substance use and neurological problems. in particular, we also know that people with gambling problems tend to present to gambling treatment quite late, if at all. But we also know that that same group of people will tend to connect or engage with healthcare for other problems before they engage around their gambling. So this particular project is looking at how we might actually intervene a lot earlier when people first connect or engage with the healthcare setting around other problems. So we've conducted a systematic review and meta-analysis which found increased prevalence of problem gambling amongst psychiatric and substance use population patient groups in particular, but there are issues around the reliability of those estimates that were obtained, probably because of the way the different methods that are used to measure problem gambling across those different settings. But what was quite clear was that there was really very low self-disclosure in that hospital environment, and that screening by health clinicians in the emergency department and other hospital departments was quite low and problematic. And this is something that Dr. Strauss from our team has noted when he's conducted patient file audits in the hospitals within Southwest Sydney local health district, where he's also noted either none or very low reporting despite high community prevalence in our catchment area. So we're undertaking a prevalence study among the hospitals based in Southwest Sydney local health district. This is the project that's funded by the Office of Responsible Gambling, currently on hold at the moment because of COVID, but we are hoping to recommence data collection next year and be able to finalise that study by the end of 2021. So the second healthcare setting that we're focused on at the moment is drug and alcohol treatment. So again, we're conducting a client survey that's focusing on trying to get a better sense of the prevalence of problem gambling among drug and alcohol treatment clients, but also looking at the pattern of substance use associated with that risk around gambling. And we've conducted a small number of interviews with clinicians to have a look at their level of awareness around this comorbidity, to look at their current screening practices, what helps or hinders their ability to screen for gambling amongst their client group, and also to have a look at their experiences or their opinions around whether we should be integrating gambling treatment within drug and alcohol treatment, or whether there is a case for keeping it separated and having a strong referral with those gambling services. Next year, after we finish data collection, we hope to be undertaking some co-design workshops with drug and alcohol clients and clinicians to actually develop screening and referral pathways that are appropriate to the different settings that drug and alcohol treatment is provided in, and to also review and have a look at the resources that we might be able to use with clients, for clients, but also with clinicians. So I'm just going to present some of the preliminary data that we have in relation to this study. So at the moment, we've conducted the survey with 43 drug and alcohol clients, predominantly from the inpatient withdrawal management unit. So these are clients going through detox, and some also from court diversion programs. So this is the drug and alcohol treatment for clients that are involved in the criminal justice system and where their substance use or offending behaviour is related to their substance use. So the participants we've surveyed so far predominantly are male. So we need to keep that in mind when I am sharing these results with you, because we know that male gender is associated with increased risk for gambling, problem gambling. And so we need to address this bias in our sample as when we continue to collect data next year. You can also see on the right-hand side the graph showing the current substance use problems for the samples. So this is not the drug and alcohol problem that, or the principal drug of concern that might have brought the participant into treatment, but it's their current substance use. You can see that nicotine is the most prevalent substance use problem amongst our sample, but also that alcohol and stimulants, which includes cocaine and methamphetamine, also quite common. So how common is gambling among our substance use treatment clients? Well, it's quite common. The red bars show the 12-month, the lifetime prevalence, which is measured by the SOGs, and the purple bars show the 12-month or past year prevalence. You can see that in the past year, we've roughly got about a third of the sample that have screened positive for having a gambling problem, but there's also a group of participants that are considered at risk. So when we look at these two groups together, around 55% of participants where there is some level of intervention is indicated. So in terms of current screening practices, the interviews indicated that assessing for gambling was part of the drug and alcohol assessment or tool or framework, but it's not routinely recorded. So we can't compare our survey findings with that of what's actually collected clinically. Part of the reason for this potentially is because the gambling questions are embedded within a set of questions around financial stress. And so the gambling, it's hard to know whether gambling is specifically asked for and whether clients are actually feel comfortable to offer that information to clinicians. The interviews also suggest that there was some reticence among clinicians to screen for problems where there was no clear referral or treatment options available. And this seems to be partly related to the fact that some of the drug and alcohol treatment episodes are actually quite short. So people coming into detox may only be connected in that space for 3 to 5 days. Those in the court diversion programs, potentially in the merit program, might only be involved for 3 months. So the length of the treatment episode was partly part of the reticence that some clinicians had, particularly where waiting periods to access services were quite lengthy. There also appeared to be a significant lack of awareness among clinicians around the substance use and gambling comorbidity issue. This seems to be related to the level of exposure to gambling that clinicians have. So the more exposure that they've had in the past in dealing with gambling problems among their clients, the more likely they are to screen for it. But there was also some concern from clinicians about gambling not being the primary presenting problem or reason for why people were connecting with their drug and alcohol service. And so there are issues there around addressing client readiness and also the relevance of assessing and referring for gambling when people are primarily presenting to address drug and alcohol issues. So can we predict someone who has a gambling problem based on the findings to date? Not very well. You can see here of all the problems that the different drug and alcohol types, that stimulant use was the only drug type significantly associated with having a gambling problem. This is consistent with what clinicians expected and what the literature talks about. However, we do need to do, so we need a larger sample size to actually unpack some of these relationships a little bit more. It doesn't appear, there doesn't appear to be a relationship between when people develop their substance use problem and that associated with gambling harm. Although we know that for roughly 2/3 to 3/4 of the sample, substance use actually predated gambling. So substance use problems come first and then the development of the gambling problem after that. And there was no clear relationship between psychological distress or financial problems, and gambling harm, possibly because substance use also has significant impacts on people's relationships, their social roles, and their employment. So in summary, gambling comorbidity is highly prevalent among substance use treatment clients. We need to do some more work around looking at that pattern of association between different drug types and gambling, and also whether that pattern of association looks different across different treatment settings. There is a lack of awareness among clinicians, and so we do need to focus on invest in some more training and also have a look at the resources required by clinicians. And we also need to do some more work around screening, because the relationship between substance use and gambling would suggest that universal screening is required, but this probably needs to be a little bit more targeted and nuanced, depending on whether people are presenting with detox versus counselling versus pharmacotherapy. We also need to, really important for us to consider the experiences and the views of the clients in understanding when it's most appropriate to screen, what their expectations are around the combining of support for gambling and substance use.
Thanks, Elizabeth, very much. Sorry, yes, your details are here. Is there anything else that you wanted to just
No, that's
fine.
Thank you very much.
That was a really extensive presentation. Thank you, and some really interesting results from that. So we've got some questions now for our presenters. So it's great people have been using the Q&A box, and if our presenters, Nick and Elizabeth and Kate and Barbara, can just stand by and we'll see how we go. I think the first couple of questions are for Nick. Are you there with us, Nick?
I am, yes.
Excellent. So obviously, Nick, there's some people asking questions about, are there any particular groups or characteristics about GPs or you know, public health networks or whatever that are keen or reluctant to screen or refer people? Are there, you know, barriers, I suppose, to what GPs and the like want to do?
Certainly. So, Chris, thanks for that question. And I think what we found was the reluctance, at least for GPs, comes through that kind of lack of training and awareness of gambling as a health issue within their everyday general practice. So it's not really, I don't think it's a particular group or characteristic of GP or practice nurse that, you know, would have an issue with it. I think what we found was once they started asking the questions, they became very comfortable with continuing with screening in that way. So, but of course, we know at the moment that the treatment path offered is there's a mental health care plan and a subsequent referral to a psychologist. So even just by virtue of letting our GPs in the pilot know about the other referral options available, they were able to utilise that.
Okay. And following on from that, as you can probably see, there's a question for you about promotion strategies to promote the tool amongst GPs. Have you had opportunity to think about that?
I have. So thank you, Erin, for that question. The Primary Health Network is in a bit of a unique position because, of course, we do regularly communicate with GPs in our area for all manner of things, you know, training, support, accreditation, etc. So we heavily utilise that as a recruitment tool for GPs. On the community service side, we really leveraged off the fantastic networks that the Fairfield City Council has in that area. So obviously, I think any one of these projects, right, they all benefit from those really strong community ties and connections that are already existing.
Yeah, and certainly I think we've put some links up in our chat box about the project and the like, and certainly I hope you're sticking around for later on, Nick, about our discussion about what we can do together. So how we can get this information across to other PHNs and community service providers, and that we can embed this tool as some of our people are commenting on. So that would be great. Yeah, so I think that's probably all those questions. And because we're running a little bit behind time, as always, I might just keep it rolling on. So and we might move to our next set of our new projects which are starting. Thank you to our speakers from before, but we might talk about some of the new projects that have been funded in the area and to hear what they're going to be doing in the upcoming year. So first up, I'd like to introduce Catherine Warner and Peter Hope. They're going to talk about the new project, the Responsible Gambling Community of Practice Facilitation Project, that's being delivered by Fairfield City Council's Social Planning and Community Development Group. So, Catherine and Peter, over to you.
Thank you, Heather. It's lovely to meet with everybody today. I'm just working on starting my video at the moment. Yep, okay, great. So welcome everybody to today's GambleAware Week presentation. Excuse me for a minute, I can't actually see my video. There we go, share screen. No. There we go. Yep. All right, I'm up and running. So today, Council's going to announce two brand new projects. First of all, I'll present one and then I'll hand over to my colleague, Sean Lee. So we're really excited to work on the projects for GambleAware Week from Fairfield City Council. The first project is the Responsible Gambling Community of Practice Facilitation. This is funded until December 2021 and it involves the employment of a full-time worker to oversee the project. And this project is funded by the New South Wales Office of Responsible Gambling, and acknowledge Erin and people from the office here today. It's lovely to meet you. So the aim of the project is to educate, facilitate, promote and train our local community of practice in the Fairfield area. So it'd be great to have medical, community worker, psychologists, social workers, all the many types of professionals working together. And we really encourage and invite you to be involved. So why are we doing this? As discussed by many speakers today, Fairfield has a fabulously diverse community and we do have a high level of economic vulnerability and disadvantage. At the same time, we have a high proportion of profit from gaming machines in licensed premises in Fairfield in comparison with both the Sydney region generally and with New South Wales as a whole. The key activities in this Community of Practice project are firstly to establish and facilitate the Fairfield Responsible Gaming Community of Practice, and secondly to develop and deliver gambling harm minimisation education programs for community workers and train the trainer programs so community workers can then deliver education programs to the community. We aim to promote gambling harm information to Fairfield residents, and in particular we'll be designing and delivering workshops for young people on reducing gambling harm while gaining skills in developing digital resources. So Council's leading the webinar for Gambling Awareness 2020, and please watch this space for a program in 2021. So the progress to our project to date, we've mapped out our project logic and our data collection plans, and we've recruited a full-time worker, and we're facilitating today's webinar. We're promoting interest in the community of practice and really invite everyone to participate. So where did we get to from today? The backstory is that after years of ongoing local action and concern about gambling, the Gambling Harm Reduction Forum was convened in 2019 by Fairfield City Council with local partners as part of Responsible Gambling Week last year. Forum participants concluded that There's really great local support, resources, passion and care available, and we really need to connect those services to provide the best practice for our community. Observations made last year during the forum include that reservoir of knowledge and funding is available, that the services really need to connect and may have differing approaches we need to integrate. We really need to fill gaps, involve all parties, and also measure our successes as we learn and grow. We definitely need to produce harm prevention strategies as well as harm minimisation strategies. And it's great to hear a lot of speakers talking today about changing the language that we're using about gambling harm minimisation. Observations made in the 2019 forum about the local community include that the general community is often not really aware of the full scale of the problem. It can be hard to attribute some issues clearly to gambling. People live complex lives, as the previous speaker mentioned, so tracking the gambling concern is something we're all learning about. Was observed that the whole of the community can be part of our solution, and living to those with lived and listening, I'm afraid, to those with lived experience is really crucial. The objectives of our community of practice project, I've got 4 of them. First of all, to build expertise in our local community of practice with all our practitioners. And secondly, through that shared expertise to support local consumers to address gambling harm behaviours, including reducing stigma about this issue. Thirdly, we'll aim to provide resources and programs which are culturally and locally relevant to Fairfield's consumers and that are readily accessible, both digital, especially with COVID, and in hard copy, and using translations and or interpretation service as appropriate. Finally, we aim to develop a sustainable service model for that community of practice. So there needs to be ongoing education, innovation and collaboration over the medium to long term to address these programs. Thank you. And there's a second project locally to announce too. I'll hand over to Sean.
Awesome. Thanks so much for that, Catherine. And thank you to all our previous speakers as well. And I'd like to say a big thank you for welcoming me into your space as experts in the gambling area. So I'm going to try and speed through this because I know we are short on time. But sorry, Heather, I would really like to take a little bit of time to acknowledge the traditional custodians of the land on which I live, work and play, who are the Cabral of the Darug Nation, and also acknowledge any elders past, present, as well as emerging in our midst today, and any Aboriginal people present in the room. So, as Catherine said before, I work at Fairfield City Council as a Community Projects and Partnerships Officer, and my remit is specifically to do with youth programs. So Fairfield City Council has recently received some funding for a program called Pay to Play, which is a project for young people, and it's been funded by the Odds on Youth grant program, which has been delivered by the Office of Responsible Gambling. So, why young people? Young people isn't normally an area which is talked about much when it comes to gambling harm. And that may be because a lot of venues for access to these kind of activities, like pubs, clubs, and casinos, are only open to people who are over the age of 18. But it's really important for us to really include young people in this conversation because we want to acknowledge and recognize young people as people who are being affected by gambling harm. I think those of us who have worked in direct service, whether it's in a drop-in setting or whether it's in like a casework setting or counseling, this is a conversation that we have with our young people constantly. It may come with other things, like it may come with a young person coming into your setting to ask for some food because their parents might not have enough to feed them and their family or their sister for one particular day. It may come with a young person reaching out to you for brokerage because they're in debt, because they spent their first paycheck on the slaps at the local hotel. But the gambling harm is something that affects young people's lives, whether or not they are over 18 or under 18. So this is something that we really want to intervene in and something that we want to acknowledge as well. So pay to play, and sorry, thanks for doing the slides as well, Catherine. Really appreciate it. But pay to play is a, oh, sorry, Catherine, could I go back to slide number 13, please? Just the one before? Awesome, thank you so much. So Pay to Play is a program that's all about early intervention, harm minimization, and community education. We want to work in partnership with young people aged 12 to 24 years to design VR videos and interactive VR resources. Because for us, we really need to make sure that young people's voices are not invisible in this conversation. So anything we do, anything we deliver, we really want it to be co-designed with young people as the consumers and as the people who are directly affected by this program. So we're looking at the creation of digital VR resources aiming to promote awareness, knowledge, and skills. Aiming to promote awareness, knowledge, and build up the skills for young people to identify and resist the marketing of gambling companies and the techniques and the little tricks that they use to try and get you to spend money on their products. After we create these resources, we want to make them available to youth workers, teachers, and the general public. And that's where we really need to tap into our local schools, our local youth centers, and our local hubs like the libraries. And sorry, could I please go to the next slide? So why are we doing it? So as I said before, we really want to look at young people's lives holistically and ensure that young people are included in the conversation about gambling harm. We want to tap into their experiences and we want to intervene where possible and really empower them to make informed choices about where they're spending their money. We've seen a recent convergence, and I think Dr. Sally Gainsbury from the early half of the day has done a lot of work into this. We're seeing a convergence of video and mobile gaming and gambling, where video games are introducing gambling elements into their products. So, for example, it was a big thing in the news and amongst the gaming community last year with a certain basketball game introducing slot machines into the actual game. I won't name that basketball game in case I get in trouble, but I think people know what I'm talking about when I mention it. It's not the only example of this though. Loot boxes have become pretty much a staple in a lot of sporting games, video games, and first-person shooters, as well as the pay-to-win element in microtransactions in mobile games as well. And finally, we really want to break the cycle and empower young people in order to prevent problem gambling from developing in the first place. So we really acknowledge our position as an organization. We do not deliver a direct therapeutic service. So we need to acknowledge our role is really in that community education space. So I think as a lot of our sector colleagues touched on earlier in the day and very valuable speakers as well, this space really parallels what we, the kind of areas we already work with in drug and alcohol, in other, speaking about other addictions and speaking about other barriers within young people's lives as well. So we really want to focus on that harm minimization approach in really tapping into young people before their gambling behaviors become an issue which extremely negatively and sometimes irreversibly affects their lives later on. So thanks, Catherine. Can I go on to the next slide, please? All right, so the last part is how to get involved. So we are looking at hiring a project worker 3 days a week from January to December in 2021. we're looking for someone who is essentially a youth worker, someone who is good and engaging young people, especially in a steering committee setting, and someone who really works in partnership and in co-design with young people. We don't want a worker to come in and be prescriptive about the resources that they're going to roll out and implement. But we're also looking for a worker who's really open in using technology in the youth space. Doesn't have to be necessarily need to be someone who's an expert in technology themselves. That's where we can engage stakeholders like coders or filmmakers or people who are expert in the VR field to come on board as contractors. But if this is someone, if you know someone who might be interested in this kind of job, please refer them over to us. The next part, and probably the most important part, is please refer any local young people who may benefit by being on the steering committee. Like I said before, at the end of the day, we are delivering a youth resource, so it really needs to be co-designed by young people themselves. Otherwise, there is no way that we're going to make it relevant to the people that we're trying to help. So if there's any young people within your service or that you know of personally that might benefit from being on the steering committee, please get in contact with us. And finally, once the final digital resources are developed towards the end of the year, if you would like this product presented at your service or at your school or within any group of young people who you think would would benefit by engaging in these resources, please reach out and connect with us as well. And finally, I'm sure if you have any further questions about either one of our programs, either myself or my teammate Catherine, we'll be sticking around for the question times at the end of this session as well. But here are our contact details. If you would like to reach out, please note them down and feel free to get involved. And I can see Heather popping up. I can't hear the Oscar music yet, but I might hand it over back to you. And yeah, thank you so much for your time.
I don't know about the Oscar music, but then keep working on it, Sean. That's all I can say. Hey, some fantastic projects there. It sounds, and actually picking up on some of the things that we talked about, perhaps in this morning session or even earlier today, about young people and online gaming and some of those things. So that's some really exciting stuff, and obviously the community of practice projects really interesting too. But hang on, we have yet more. There's a third project that we're going to hear about called Game Over, which is focused really on Vietnamese youth gaming and gambling, being run by the Woodville Alliance. And the Woodville Alliance, for many of you may not know, is a community-based agency based in Western Sydney with major programs in disability, mental health, family and youth support, community development, early education and childcare. So they do an awful lot in this community and a fantastic organisation. To tell us more about this really innovative project, we've got Marie Saltis who's going to tell us more about Game Over. Over to you, Marie.
Hello. I'm just hoping that everyone can see my screen. Just getting started. Okay. So I thought that I would talk a little bit about some of the issues around gaming as well. So I'm covering some of that in this presentation. So my name's Maria Saltis. I'm the Program Manager of the Family Mental Health Support Service here at Woodville Alliance. So the Woodville Alliance, most of you would know about us. So we're in Greater Western Sydney and we run a lot of different programs in disability, mental health, family and youth support, community development. Yeah. So just some background to the Game Over Vietnamese project. So the family, why did we sort of think about this project? The Family Mental Health Support Service here at the Woodville Alliance, we actually see quite a few referrals from families and young people where they are experiencing gaming behaviour and a lot of concern around that from parents. The types of behaviours that we've seen have been things like disengagement from school, isolation, withdrawal and aggression. And often the aggression is associated with gaming, the games being taken away from young people. And other youth services, as Sean mentioned earlier, are experiencing these kinds of referrals and are aware that this is happening amongst our cohort of young people. In 2019, we ran a seminar with Professor Wayne Warburton for the local community, and we found that the interest in the seminar was really quite high, and there were parents who attended that seminar who were really at a loss of how to manage what's happening for their children. I think it's also really important to mention that internet gaming disorder is now in the DSM, so it's in the Diagnostic and Statistical Manual of Mental Disorders, so it is a diagnosed mental illness. What is the allure of gaming? So what is it that makes young people interested in gaming? So we know that it's an escape from the real world for young people, and so it can also change their perception of self-worth. They can escape to a fantasy world, and where they can play, have online role-playing games, such as like Warcraft is an example of that. So in these games, the player can assume the role of a fictional character, so they can interact with other players in a virtual world. So you can see for some young people where there may not, things may not be fabulous in their real world, that gaming does play a role for them. I've actually taken this from Wayne Warburton. He says that it doesn't matter if the behaviour is an addiction or not, if it's called that or not. If the young person continues to play despite experiencing significant negative consequences in other areas of their life, for example, ignoring school or friends, then computer gaming is a problem and it needs attention. And what we're seeing in our practice is that a lot of young people are just not going to school and in fact not even leaving their bedrooms. So some of the warning signs are things like an obsession with internet, online gaming, withdrawal, irritability, hostility. There can be violence and aggressive outbursts, and a lack of functioning, loss of interest in other activities or friends, lack of sleep, lying about the amount of time spent playing games, avoiding dealing with real life concerns such as anxiety or depression, difficulties with schoolwork, peer-related problems, or family-related issues. And they build a tolerance to gaming. So similar to other addictive behaviours, they need more time, need to spend more time to satisfy the urge. So some of the things that we've also seen is that there's the rise of emerging technologies and online gaming. So Sean talked about this as well, so that we're seeing that young people are being exposed to gambling-like content in gaming, which is making them really vulnerable to future gambling behaviours. In research, that there's indications that half of young people in Australia have participated in some form of gambling. And in 2019, Fortnite and Minecraft, which are two online games, actually were ranked as the most searched game titles in Australia. So these games also use loot boxes, which is a virtual currency, and there's a lot of concern about the introduction of loot boxes in online gaming. So why did we think of Fairfield and Vietnamese young people in particular? The project's been funded by the Office of Responsible Gambling as well. So Vietnamese people make up approximately 20% of the Fairfield population. Fairfield is one of the most disadvantaged areas in Sydney, and it has very high gambling losses as discussed today. And research around problem gaming and gambling in CALD communities, such as the Vietnamese community, really show us that we need to do some very specific, culturally appropriate types of interventions for the community. And there's also, the need for this work to be really culturally appropriate and youth-friendly as well. So I think when we're working with young people and when we're talking about gambling harm and the convergence between gaming, that it really does need to be presented in a way that is going to be culturally appropriate, but also that young people are going to be able to connect with what we're trying to say. So this is how we've decided to approach the project. We are producing some short films that will focus on how gaming can lead to gambling through the emerging technologies like loot boxes, and will aim to educate young people about this along with where to find help. That's an important part of the project as well, that we actually look at where the resources are and where the help is. So the films will be in English and Vietnamese, and they're going to be designed by young people. And we want to make sure that by having young people involved in that the films will be culturally appropriate and youth-friendly. And we're also going to include experts in that content as well to inform the films. At the moment, we've got support from the youth reference group at Headspace Liverpool. So that's a group of young people who are really keen to be involved. We've already had a meeting with them. They've got some great ideas. We're opening up that reference group for other young people and for young people who have lived experience as well. And we're going to be promoting the films on social media platforms like Instagram and Snapchat. So the films, there'll be some short grab types of films too. So really very short productions, so that's going to appeal to young people on social media platforms. And we're hoping that the evaluation of the project may also give us further insights into how we may need to work in this space moving forward. And we're also going to make the films available to local high schools, community centres, youth centres, and we also want to provide in the films some education around gaming and the convergence to gambling, along with referral pathways as well. So the way that all of the participants today can be involved is we can give you access to the films so that you can promote those films yourself on your platforms. We're hoping that we will be ready to roll these films out in 2021, around February. We're also hoping that we might find other young people with lived experience to join the reference group. So if you do know any young people, we'd be really happy to speak with them. And I'm available for any information or follow-up that anyone might have around the project, or gaming in particular. I thought I'd also just include in this presentation, because I think a lot of people are really interested in gaming, and there's just, in Western Sydney, it's really difficult to find services and particularly psychiatrists that are working in this space, or psychologists. They tend to be more in central Sydney. So there are some resources that I just felt for, if you're working with families, may be helpful. So some of these are, these are in the, I don't know if we're going to share the actual presentations, but so you'll have access to these, but there's some really good resources that are good for parents as well. So Dr. Brett Conrad is a clinical psychologist, and he's put together some really interesting resources that are available from this website. Raising Smart Kids, that's the other side of the coin. There are actually some positives for young people with gaming as well, and I think it's important that we recognise that at times as well. There's a TED Talk that's included in that, and there's also a Canadian site that's called Live Learn that also has some really interesting information for people too, and it looks at things like how many hours on a computer game, etc. And then the next one is Rules for Gaming for Teenage Boys. That's a Huffington Post link, and I think that is also very readable and really useful. So I'm hoping that those sorts of resources might also be helpful for people. Thank you.
Thank you, Maria. That was fantastic. And yes, those resources will be available. We're making sure that information and links are on the recordings that people can access after today. We'll be sending you a link to these sessions, and they'll have all the resources with that. So yes, that's great. You don't have to take copious notes. It will be coming to you. So thank you very much. Actually, it's pretty interesting. I felt this section on the new funded projects, we really have some really a different area of focus, I suppose, that these new projects have been looking at compared to our earlier projects that talked from the health perspective and GPs and the like, and screening tools. So interesting that, and I think one of our speakers this morning talked about the importance of having a range of different projects, a range of different ways of tackling this issue, and that we need to spread the web out quite wide. So some really exciting stuff there. Thank you to those presenters. Really interesting about online gaming and youth, cultural diversity of our communities, and really focusing on those. So thank you. That's terrific. Those presenters are standing by too if people have questions of them about these new funded projects. I haven't seen many come through yet, so there's still time to get those in if you're interested about them. Or maybe we're all feeling a little tired. I'm not sure. So has anyone got any questions they want to put in the Q&A? Or we've done our deal for the day. That's okay. That's okay. There'll be plenty of time to talk and get in touch with people, so that's not a problem. We do have an evaluation survey about this webinar that will come to you very shortly. We really appreciate if you would fill that in for us, because we want to know, you know, what you've thought about the webinar this afternoon, what sessions you enjoyed, and how we can tailor these to meet your needs further. So it's really important to have that, and I think Peter will be sending that out very, very shortly. It's already there. Oh yes, it is too. Thank you. That's terrific. So thanks everyone for joining us today. Please remember, it will be available on YouTube, session 1 and session 2, which you've just held. And we'll send you some links to that. There's some great services, things that, and resources for you to look at. I'd like to thank all our presenters today. It's been fantastic. You've been very good at keeping to time and really giving us some great information. So thank you very much. And particularly I want to thank the Fairfield City Council team, to Martha, Chris, Peter, Catherine and Susan, who put so much effort into getting this together. So thank you very much. We've done a great job, team. So it's been terrific. If you're going to be joining us later on this afternoon for session 3, you'll need to come in through a new Zoom link. So go back to your email. There's another Zoom link there to join that. Session 3 is an invitee only session where a number of organisations will be getting together to talk about what's come out of these sessions this morning and today, and where we go to from here. So thanks everyone. Take care, be COVID safe, very important. Hopefully we can have a face-to-face meeting and event very soon, but we all need to be very careful and COVID safe if we want to do that. Thank you for your interest in and questions around Gambling Aware Fairfield 2020. It's a really important topic, and seeing from all these presentations we've had today, I'm quite positive about our year ahead. I think there's lots of work happening, lots happening in the space, some really quality stuff that's happening, and certainly work that will benefit the Fairfield community and many other communities as we work together to eliminate gambling harm. So thanks very much. For session 3, tune in another just before 3 o'clock. That'd be great. See you then.
Thanks, Heather. I'll see you later on.